So implications of what you call it for treatment and intervention. Behavioral plan and parent training. Social skills training, group interventions, role playing, visual spatial versus primary social difficulties. So what do I mean by that? Well, first of all, I come up with, when I do the IEP, the social skills for the kids on the spectrum who are higher functioning becomes one of the main points, if not the first point on an intervention plan. That and the language, the two biggies, okay? But you're looking at also parent training. Why? Because parents have to learn to interact with these kids differently. And part of it is also setting limits. I remember around probably 2000, 2001, I was doing a seminar for a group of educators outside of Washington, D.C., where I was living at the time. And somebody said to me, Dr. Forrest, what would you do if you had a child with autism come into the school with a gun? What's the answer? What would you do for a child without autism that came into school with a gun? Now, you wouldn't necessarily discipline them if having the gun was a result of the sort of issue or the autism, but that's really not a byproduct of autism, right? Bringing in a gun to school. Now, whether they understand the consequences and what have you, maybe as a result of executive function impairment, but all those sorts of things. But that child needs to be subject to the same sort of rules and disciplinary behaviors that other kids that are not on the spectrum are. And so having a behavioral plan and having parents who set good boundaries and good limits for these kids, really important. Because we just still don't know what causes it, there's still often associated with it such guilt in families that they don't set the boundaries, they don't set the limits. And I'll be the first to say that the kids who do well are the kids whose parents actually say, okay, you've got autism or you've got whatever, let's go. We're not going to use that as an excuse, and if you want to go to college, that's what we're going to do. You're going to have to work harder for the higher functioning kids. Treat the sense of isolation. We've talked about that. Make sure you sort of look at the depression, anxiety. Inclusion in the DSM of social disabilities and other nonverbal disorders of learning. I think it's a way off, but I really think that that's one of the issues here. We're seeing, and I think the DSM-5, if it really does go the direction we're talking, we're going to just see a whole bunch of kids lumped into that category with social deficit, and high functioning kids are so much different than lower functioning. Better assessment and understanding of social impairment and other psychiatric and neurological disorders. This is really key, guys. A good assessment, an IQ, just an IQ assessment on these kids and a Rorschach isn't going to do it. If you take nothing else from what you learned here today, get some of these instruments, the PDD-BI, the social responsiveness scale, get those instruments, find out where the deficit is. Is it because of a visual spatial issue? Is it because of attention? And then map that into the interventions. I think that's one of the key things that you can do for kids. So implications for diagnosis for the higher functioning kids, we need some new criteria, which we're going to get with DSM-5, but I'm not sure it's in the right order. Visual spatial disability, I'd love to see that in the DSM. Again, we need research, kids who have problems with that. Use of the word syndrome that encompasses a lot of kids. Open issues, epidemiological study, evolutionary nature of the relationship between social function and cognitive abilities. So one of the big strains in autism literature when I started was executive and function impairment, and that was a result, the executive function deficits cause the social disabilities. You almost don't hear that anymore. How many people have heard that lately? Or have heard that at all? One, yeah. I mean, that was really big in the early literature. Now it's sort of fallen by the way that executive function deficits could explain all the social abilities. So part of the issue is when you do imaging work, how you're looking at the social abilities. And with these new technologies, we're going to find out more about that.